Oh, welcome back, you guys. Thank you very much for joining me. My name is Swadik Mayanja. You can call me Q. And on this podcast YouTube channel, I bring to you news, current events, and fun topics. Fun topics for nurses and healthcare providers everywhere. Tina.
Hey.
Tina, welcome. Today joining us is our old friend Tina V. from Good Nurse, Bad Nurse. Tina, how have you been? How are you dealing with all of this COVID virus situation? What's going on in life?
I'm good. I'm dealing with it just fine. It hasn't really affected me personally yet. Hopefully it won't. I recently transferred floors at where I work, and so I've been in orientation for a few months. And so because of that, I have a preceptor, and if I were to transfer to the unit where all of the COVID patients are, it would require double PPE, the use of double PPE, and we don't want to do that. So I haven't.
What do you mean? I'm sorry, I'm confused. What do you mean double PPE? Why would you need two PPEs?
Because I have a preceptor, so there would be two people.
Oh.
Yeah.
So we're talking about math now.
Yeah.
Yes. No, that makes sense. Wait, that's really, I never even thought about that. That's a really good point.
Yeah. I'm glad someone thought of it, because I never really thought about it. I just assumed we'd go wherever. But I'm kind of, it's kind of nice that I've been able to just kind of be in orientation through all of this and learning. We haven't had visitors in the hospital for the past couple of months, which has been really difficult on the patients. It's been hard seeing them deal with all the stuff that they're dealing with and not having their family there. But on the bright side, for me personally, if I just want to be, selfish about it, it's been kind of nice, because I know you probably know this, and most nurses know this, it's not easy learning in an environment where you're being watched constantly. You're already being watched by your preceptor and the patient. But to have family members, sitting there watching you, scrutinizing everything you do, and you feel like they're judging everything you do. They're probably not, but
no, they probably are. They definitely are. What are we talking about? Have you ever been a patient or visited a family member? All they do is judge the healthcare provider, especially as another healthcare provider. But it's a really good thing that you pointed out. It is very different. And yes, like bigger picture, it really, really sucks. I know you just said you're not doing the COVID, you're not taking care of a bunch of COVID patients, but when you see COVID patients and them struggling, especially the young ones who are not like frequent, I don't like to say frequent flyers, but don't have comorbidities, who have never been in a hospital before. Right. And then on top of that, you tell them you can't visit the family. That sucks. That really, really sucks.
Yes.
But you're right. Being a nurse and dealing with family members, like healthcare providers and family members have a love-hate relationship. It's great when the patient can't speak for themselves, but when the patient can speak for themselves, we just want you to sit there and comfort. Don't talk to them. Don't talk for them. Don't talk to them. Don't talk to me about them. Everything they need to know, they could tell me, okay? But, I digress. I digress.
It can be very frustrating, especially if you're asking the patient a question because you're trying to figure out whether they know the answer or not. You're trying to maybe assess their orientation, and the family member answers the question, and you're just like, I don't really care if you know what the date is. I mean, it really doesn't matter to me.
It really doesn't matter that your husband's friend's date of birth, where they are, why they're in the store. It doesn't. What matters is, does the patient know?